Make sure that this is okay. Probably give people a couple minutes to join.
Yeah, no worries.
Hi, welcome everybody. We're just gonna give folks a couple more minutes to join us and then we'll get started. I'm gonna wait one more minute and then we'll start.
That's a beautiful picture on there. Wish I was on that road right now driving.
I know. I think it's just a stock photo. I should actually start adding some from like actual photos of travels, or solicit people from our region for pictures.
Yeah.
Okay, I think we'll get started. We have a good amount of people on and hopefully we can catch others as they join. So welcome everybody to our learning opportunity for June 25th, 2018. Thanks for joining today and hope everybody's having a great summer so far. I know that I am. So I think we'll just start with introductions and what usually I think works easiest for a group of our size is that I can run through the participant list and announce your name, and then if you could just introduce yourself and your role at your organization, and then just to warm us up today, if you could share something you're excited about this summer regarding your injury and violence prevention work, I think that would be really great to hear. So I am Colleen Kapsamalis. I'm the Program Integration and Evaluation Unit Manager at the Colorado Department of Public Health and Environment. I know that many of you know me already because I've been coordinating the Plains of Peaks Regional Network. And something that I'm excited about this summer is actually hoping to hear about the results of a lot of our grant applications that we submitted this spring and hearing whether or not we're funded for some new and exciting projects. And then another thing that I'm excited about is that I'll be traveling to Utah, to Salt Lake City at the end of July, early August, to participate in the state technical assistance visits that Safe States Alliance puts on. And so I'm excited to meet some of our Utah regional partners in person. And then going down the list, Dwayne, would you mind introducing yourself and something you're excited about?
Hey, it's Dwayne Smith with Children's Hospital Colorado.
Hi, Dwayne. It's something you're excited about regarding your injury and violence prevention work this summer?
Sorry, I just logged on and I'm catching up. I'm excited to announce that we have a vacancy for a prevention coordinator currently open that will fill the role of the Safe Kids Denver Metro, as well as the larger body of work for our level 1 pediatric trauma center.
Yeah, thanks for sharing. I think that I shared that announcement with the regional network, but I can resend it if you'd like. I don't actually, I'm just looking at the blog now, and maybe I didn't share it. So if you want to resend me the job posting, I can share that out.
Sure, and just to clarify, we also had, the previous one may have been for Colorado Springs. So we filled it for Colorado Springs.
Okay.
And we currently have one for the Aurora area.
Yeah, definitely share that with me. I have another job posting that I was planning on sharing as well from the Rocky Mountain Public Health Training Center. So I can share those both out at the same time. Jeannie, would you mind introducing yourself?
Yes, Jeannie Beets with the Nebraska Department of Health and Human Services Injury Prevention Program, and I'm the Motor Vehicle Safety Coordinator. And I'm excited about this summer. We're kind of getting more resources and things put together for our Teens in the Driver's Seat program. We have 31 schools participating at this point. We're hoping to bring some more on, and our program is really, through the surveys we do at the school, we're starting to see really some great movement in the change in knowledge and behavior of those students within those schools. So our last report was 16 of the 17 driving behaviors we survey. We actually saw improvement in every single one except for one area, which was drowsy driving. So that's what we're working on this summer and getting ready for the next school year.
Cool, thanks for sharing. Peg, would you like to introduce yourself?
Sure. I'm Peg O.G. Ginsberg. I'm the program manager for Nebraska Injury Prevention Program. A couple things. We are working with we have a facilitator we're working with our state coalition to develop a state plan, an updated state plan for the sexual violence prevention work, kind of in anticipation of the new announcement that will be coming out. So it's great to be able to work on that. And I'm also doing a stat visit this summer. I am actually the team lead for the South Carolina visit, which is coming up just a few weeks before Utah. So yeah, it's a cool experience. I don't know if you've done that before, Colleen, or anybody else that's on the call. I would encourage any of you to take the opportunity to do one of those if you get a chance.
Oh, good to hear. Tracy Hardy, if you wouldn't mind introducing yourself.
Yes, I'm Tracy Hardy. I am your interim CDC project officer. Jamie Mills is away on a detail, and I'm excited about working with you all because I specifically asked if I could take on Colorado.
Oh, thank you for sharing that. I was not aware of that, so that's good to know.
Yes.
Okay. And who else do we have? So Allie, if you wouldn't mind introducing yourself.
Hey everyone, this is Allie Maffey. I work at CDPHE, and I currently manage the marijuana education program and the Communities at Care program. And I think what I'm most excited about this summer is, for the first time, we will have data profiles on scaled risk and protection coming back from all of our schools, regions, and statewide. And so that data should be available in the coming weeks. And I'm just really excited to watch communities as they digest it and start to make action steps related to that work.
Okay, thanks for sharing. Let's see, Jenna Jones. Can you hear us, Jenna? I think maybe Jenna is typing. Yes. Okay. I was like, I can hear her typing. So she's online and on the phone, but it's Jenna Jones with CDPHE. And I can still hear you typing. So just a reminder to mute yourself as well.
Okay.
Yeah.
We're in the process.
If you're typing and you're not on mute, we hear a lot of background noise. So if you could please do that, that would be great. Okay, and then next we have Anne Saba.
Yes. Can you hear me?
Yes.
Yeah. So I'm Ann Saba, and I am the communication coordinator for the University of Iowa Injury Prevention Research Center. And just something I'm busy with this summer is our renewal application for our center with the CDC. So I'm looking forward to that being completed later this summer. And also I've been promoting our center's monthly blog, which you can subscribe to at our website, uiiprc.org.
Great, thanks, Anne. Next, Des Runyon, if you could introduce yourself, where you're from, and what you're excited about this summer regarding injury and violence prevention work, or your work.
Sure, I hope you can all hear me. I'm
Yes.
Des Runyon. I'm the Executive Director of the Kemp Center in Denver, Colorado. And what am I excited about? I think we're doing some good progress. We have just working on a paper, we're looking at the decline in child abuse rates nationally over the last, since 1993, and doing some examination to feel why that's happening. And certainly the reduction in domestic violence and the reduction in teen pregnancy both play a role in that.
Great, thank you. And then next, Carol Runyon.
Hi, I'm Carol Runyon. I'm director of the Program for Injury Prevention Education and Research at Colorado School of Public Health. I guess I'm excited about, we have coming up with the Kemp Center a summer institute in about 3 weeks, and I'll be teaching a course there on the prevention of child maltreatment.
Great, thanks for sharing. Let's see, Corinne or Corey.
Sure. Hi, I'm Corinne P. Gaisag-Corey, and I'm the director of the University of Iowa Injury Prevention Research Center. So I work with Anne and Lisa, who will later introduce herself. And one thing that was really exciting earlier in the summer is that we work with a School of Public Health in Cluj, where we teach a summer course related to our NIH International Trauma Training Program. And this summer, we brought over 6 of our students to take the course, including one who'd never been on a plane before and one who had never been out of Iowa before. So it was really exciting to bring some students on their first international experience, and that it was in injury and violence prevention.
Nice. Cool. Where was that?
It started at the Cluj School of Public Health in Cluj-Napoca, Romania, and then we had a symposium in Yerevan, Armenia, which was also very nice.
Wow, that sounds exciting. Nice. Let's see, Lisa, why don't you introduce yourself, since Corey mentioned your name already.
Hi, I'm Lisa Roth, and I'm with the University of Iowa Injury Prevention Research Center. And I think one of the things we're excited about this summer is we will be recompeting for funding of our center. And so it's a great opportunity for us to just review our partnerships that we have and highlight some of the good work that we're doing in the Plains to Peaks region. And we will definitely be excited once we see August 6th come and go with the application being submitted. And then we'll wait for word of hopefully refunding.
Great. Good luck with your application. Let's see, who else? Kate Jankowski.
Good morning, I'm Kate Jankowski at the State Health Department here in Colorado, and I manage the Child Fatality Prevention System. And I'm excited, as I am every year, to get our annual legislative report out the door, and so that will be submitted to the General Assembly in Colorado on July 1st. And then the real hard work happens, where we try to think about strategies to get these priority areas, in front of our legislators. And we had a really busy legislative session this year, and so I anticipate a lot of those topics being re-brought up and there being more bills relevant to child fatality prevention. So that's always exciting to see opportunity for change.
Okay, thanks. And then Sarah Brandspiegel.
Hi everyone, I'm at the Colorado School of Public Health and work with Carol Runyon and also quite a bit with Colleen. And I'm excited. We're wrapping up the final evaluation of the Essentials for Childhood project that has been a 5-year project on child maltreatment prevention here in Colorado. And we're working with a graduate student who did a lot of interviews and writing a case study. And it's nice to see that kind of come to conclusion.
Yeah, excited to see that as well. And then Sarah Ehrhard-Reed. Oh, she is typing in. So Sarah's from the Missouri Department of Health and Senior Services, Office of Women's Health, and she's excited because the Missouri Injury and Violence Prevention Advisory Committee recently finished their strategic plan, and they're starting to implement the plan. That's great, Sarah. It would be awesome, and maybe this could be a topic of a future regional network call, but maybe we could talk a little bit about our processes for strategic planning in our different states and share those out. So I might make a note of that for future. And then there's someone who's under the number 573-230-7063. I don't know if that's someone who's already introduced themselves. And if not, and actually it looks like it just went away, so that person may have just logged off. So then I think I got everybody except for Kate Blackman, which I thought you could introduce yourself during your presentation. So Kate Blackman is is a representative from the National Conference of State Legislatures, and she's going to be doing a presentation for us today about resources that NCSL has to offer and the work that they do, and hopefully maybe we can have a discussion on some ideas on how they could be assistance to states in our region. So I will stop sharing my screen, Kate, and you can bring yours up and let me know if you have any trouble, and I can share your slides from here as well.
Great. Y'all let me know if you have any trouble. How's that?
So we see your slides.
How are we doing?
Good, great.
Great. I told Colleen earlier that I'm working with 2 screens here, and I'm not 100% sure which one you all would be looking at, so we pulled it off. Good morning. Thank you all for having me. I'm Kate Blackman, and again, I'm at the National Conference of State Legislatures here in Denver, Colorado. And I'm a program manager in our health program. I manage our injury and violence prevention work, as well as some of our other public health portfolio related to health disparities. And we do a little bit of work on some access to care topics, such as telehealth and things like that. So I'm really excited to be with you all and hear more about what you're working on, and tell you a little bit about some of the things that NCSL does and what we have that may be useful to you, and I'm interested in hearing from you all what might be more useful to you all. But a little bit of background on NCSL for those who don't know. We are the national bipartisan membership organization of all state legislatures. So the state legislature in your state is actually a member of NCSL. The state legislature does pay dues to us. If you're familiar, a lot of folks are familiar with the National Governors Association. They are our sister organization with the executive branch. We work with the legislative branch. So all 7,383 state legislators and more than 30,000 legislative staff are members of NCSL. We are a bipartisan organization, and our mission is really to support state legislatures and the institution themselves, as well as promoting some of the policy innovation and communication between state legislatures. We are here in Denver. We do a lot of our state policy research, which is probably a lot of what's most applicable to y'all's work. We also have an office in Washington, D.C. that helps provide a cohesive voice for the states at the federal level. So they monitor federal legislation, and when NCSL does take policy positions on federal legislation, they represent that on the Hill. I will note that as a bipartisan organization, I'm nonpartisan staff. NCSL does not take any position on any state policy issues. So we don't do state model legislation or anything like that, but we do quite a bit of policy tracking and analysis, and that's what I'll share with you all. So a little bit about what we do. We do a ton of research, and our research is different than, I came from public health research in North Carolina. This is a little different. We do a lot of policy research, so policy tracking and analysis. We maintain a number of web resources that I'll be talking more about that are accessible for you all. We also have a number of invitational meetings that I will call out, because every now and then we do state team meetings where we bring together legislative and executive branches branch. We have done it on injury and violence prevention in the past. So if you ever get an invite from me to be part of that, I encourage you to think about it. So we bring together legislators, health departments, legislative staff, sometimes Medicaid, rural health. It really depends on the topic, but that's a neat model where we bring together teams to create action plans. We answer a ton of information requests for our members, so at any time a legislator or legislative staff can call me or anyone here and say, you know, I want to know what other states are doing on X policy topic, and we provide that information. And then there's a number of other things. You can follow us on social media, all that good stuff. And just for those of you who are working with state legislators or maybe aren't but are kind of interested, I think it's always helpful to provide the context that we work in. You know, coming from public health, you all are in public health, we think it's really important, and it is. But state legislators are tasked with so much. Most of them are citizen legislators, so they have other jobs, as you all probably know. They might be lawyers, they might be doctors, they might be ranchers. And so they are really trying to tackle all of these policy topics that are hugely complicated, right? Medicaid in and of itself is hugely complicated, and they are working on agriculture and taxes and zoning and everything. And so health is really just one topic within that, and then the injury and violence prevention work that you do and that I do is just one component of that. So it really is important to help elevate. I will also note that one of the problems, I don't want to point out all the problems, but one of the things I think is really interesting about our work in injury and violence prevention is that state legislators don't always know what that means, right? Like injury and violence prevention. What is injury? We think Band-Aids and helmets and things like that. And as you all know, it's a lot more. So it's important, I think, to be advocates for public health in whatever way that you can. So that's my soapbox for you today. I'll leave it at that. And actually, another thing I do want to say about state legislators is that they do care a lot about data. And as you all know, state resources are strapped. We don't have huge state budgets. They really want to know how to allocate their dollars in the most cost-effective ways. And so I think, you know, the data that you all are working with, that you have in your states, I heard a couple of folks mention some of the early evaluations or things that you're working on. Those are really important to our legislative members as they really weigh those different policies. So some of the things that we have that directly relate to you all, I manage our portfolio with the Centers for Disease Control and Prevention, so we are also funded through the National Center for Injury Prevention and Control to do a lot of our injury and violence prevention work. And I'll tell you a little bit more about some of the web resources we have that include legislative tracking, our policy reports, our webinars, all of which you're welcome to join if that is something that is of interest to you. So we have, see, I told you Band-Aids. We have an injury, like a branding problem at NCSL too. So this is a screenshot of our injury prevention landing page where it houses all of the topics that we cover. So, and sometimes I just Google NCSL injury prevention, you'll find it, but I have the link here for you. So this includes some of our most recent resources, which this is also a screenshot from that page. And the page also links to a number of other resources on child abuse and neglect, traumatic brain injury, elderly falls prevention, of course, opioids, things like that. So we're working on, as you can see from the recent resources, we have policy briefs, Policy Scan, which is a policy brief, postcards, blogs, magazines, all these are free resources on our website. And a lot of the work that we do, because we're writing for a legislative audience, is very much geared toward, you know, here's analysis of state policies or other state actions, or highlighting different state examples or case studies or legislative trends, things like that. I will, because opioids is such a hot topic for us right now, I will highlight we're doing quite a bit of work across our organization. So in health, criminal justice, human services, or child welfare, as I'm sure you all are seeing and aware, we're seeing quite a bit of work in all of these areas, and increasingly, I think state legislators or legislatures, task forces, and things like that are helping to bring together stakeholders across the spectrum. So not just public health, but criminal justice and other folks like that. So this is a web page that we've built where you can access kind of a myriad of the resources that we have on those different topics. I will also point out for some of you that we did just host an Opioid Policy Fellows program, which was also funded by our CDC work, and it was a small group of 23 state legislators who applied and were selected to take a deep dive into opioid policy over the course of about 8 months, learn as much as they can and think about action steps and things that they might want to pursue in their home states. And I point that out for you because there's one from Colorado, one from Missouri, one from Nebraska. So some of the states represented here had folks who participated in that program. And the list of those folks is accessible on our website, along with the agendas and the PowerPoint presentations and the things that they were exposed to through that program. So if that's an area that you're working on and want to connect with your legislators, if you can connect with them, that's a neat intersection for some of you, perhaps. We do a ton of bill tracking, a lot of it. State legislatures, as I'm sure you saw earlier, consider upwards of 150,000 bills a year. It's a lot. We do have an interactive injury prevention database, which again, I've given you screenshots and a link. We track 10 topics, 6 are related to opioids, and the others are child abuse and neglect, elderly falls, teen dating violence, traumatic brain injury, and adverse childhood experiences. Maybe we're at 11 actually with ACEs. I'm sorry, we upped it this year. We added ACEs this year. So we track all introduced legislation on these topics. So a bill can be introduced and can fail, and it will still be housed in this database. It is freely accessible to you all. You can filter by topics, by states. Under status, there's a drop down if you just want to see what's been enacted versus everything that's been proposed. I encourage you to consider that. We're tracking around 500 to 600 bills just in the opioid space in this database, so it does get to be quite a lot when you do all that's introduced. We did launch the database in 2015 for most topics that we've been adding as we go, so if you can include all years if you're interested in kind of looking across years. And then the other screenshot is kind of a little bit of what the beginning of the results looks like, so you can print them, shows you how many states, how many bills, where it says AKHCR2, Alaska House Concurrent Resolution 2, that's an active hyperlink where you are able to click on it and view the bill text. So if you're interested in actually reading what the bill proposed, the actual language, you can do that there. But on our page, you'll see, as you can see here, the status, when that status was current as of, the authors, the topics that we've tracked it under, some multiple topics, a short summary, and the history is the legislative process history. We have a similar one for those of you working on motor vehicles. We do have a very similar interface, actually the same interface for the traffic safety bill database, which is maintained by my colleagues in NCSL's transportation program. They track a ton of topics here, which you can see a few of in the screenshot. And then this map here on it's my left, I assume it's your left too, is you can click on these different topics. It's showing you the number of bills and then the states in which they were enacted. So those are ones that passed and were signed by the governor. So this one is showing you the 73 bills in these blue states in 2017. So that's a neat feature on that page, and that link is there for you too. As I alluded to earlier, we also do a number of policy briefs. We do policy postcards, which are kind of a snapshot. So one is a cover of a brief we produced last August, and then we did a return to learn related to TBI and student athletes postcard. Again, all of these things are on our website. They're freely accessible, and they're linked from that great page with the Band-Aid on it. So if you're interested in diving into those, you can. And similarly, this is a map of one of our recent policy. Again, I do a lot of work on opioids. Increasingly, it seems like all I do sometimes. But this is one of the things that we track in the database, prescription limits and prescription guidelines. So that's a policy topic that we've been pretty active on. And this is a map from one of our pages. Again, link at the bottom. We also have a table where it's comparing some of the different exemptions that states have for these different requirements. Another thing that we're spending an increasing amount of time working on adverse childhood experiences. It's certainly something that I think is exciting that we're hearing from state lawmakers a lot more around. And in fact, in working with the folks on the opioid policy fellows, they were talking a lot about how early trauma and adverse experiences, can really underlie a lot of substance misuse. So we are tracking that in the database. Here's a map as of about a month ago. I think the statuses are current as of. And we did have, I just wanted to highlight a couple webinars for you. Again, our webinars, I would say 98%, if not 100% of them are free. And then the archives are also, I think we post them to YouTube. So anything that's happened in our archive, you can see. We tend to talk, again, kind of about the issue, about the policy landscape. We've had folks from CDPHE on a webinar before, so we like to highlight what different states are doing. We've also had legislators talking about what they're doing in their states, and that's true of both of these ACEs webinars that we hosted in the past year. We do have an ACEs policy brief coming out in August, so if that's something that you're working on and excited about, we're excited about it, and it'll be out the end of August. That's my crash course. And I'm happy to talk more about if there are specific things that you're working on that you would like to know, resources we have. I'm happy to talk about any state policy trends or things that we're seeing, and also would love to just hear more about your work and some things that you're working on. So I will leave my crash course at that.
Thanks so much, Kate. Does anybody have any initial questions for Kate? I know I have a couple, but I'll open it up to the room first.
This is Corey, and what an amazing resource. This is really wonderful. I can't wait to start playing with it. I knew you had a lot of stuff on your website, but I hadn't looked at the databases. I'm curious how you search for these. So for those of us who kind of dabble in policy research, we might want to look for stuff in our state that isn't something you track. And I'm thinking about a class that I teach. How do you even start diving into all of the state updates?
On a specific topic, or are you thinking like injury prevention, or?
No, I was like, if you have a specific topic.
We're recording, so I shouldn't tell you, but so to find NCSL resources, the easiest thing to do is really to use our search on our website is powered by Google, and it's a good search. So if there's a specific topic that you're looking for, like suicide, for example, we've done a number of things on suicide prevention in the past year. We have a blog coming out here soon on CDC's new release. And but we don't have like a landing page on it right now. Same with ACEs, it's coming, but we don't have a landing page on it yet. So if you are if you use like that Google search, you'll be able to it'll pull up a lot of those things. You can also just use Google, to be honest. Sometimes I Google my own things like NCSL and then whatever topic I'm looking for. So that's I think if you're looking for a specific topic and you want to see what we might have, I think that's one of the easiest ways to do it. Does that answer your question?
I was actually wondering about if it's a topic you haven't looked at yet, or if we want to go into more detail on something.
Like other outside resources?
Yeah.
Can you give me an example?
Well, okay, I'll give you a very specific example.
Very well,
looking, for example, at laws in states to impact school violence.
Mm-hmm.
They're all over the place. So some of them are sort of nested within dating, some are nested within reproductive stuff, some are in education, some are in health. So I don't even know how, you necessarily, for the topics you examine, how you even start finding out where to look.
Yeah, it's really
might be
hard.
too big a question.
Yeah, no, it's challenging. So, I mean, for us, right, my job is easier in that I have a database. We use LexisNexis StateNet. It's a database that pulls all the bills. And so I craft search terms that can pull all that legislation. Similarly, we also use Westlaw, which is a more of a law kind of resource. And so that's where, I can craft search terms and it'll pull whether it was, more of a health related bill or an education related bill or something else. We're able to do that. And so I have a leg up on you in that way, I guess, if you were going to do it. So I think in terms of it's finding other organizations out there that are working on some of those topics, and depending on the specific topic, we know them. I know y'all heard from the Network for Public Health Law. They're a great resource. Child Trends does a lot on some of the legislation that overlaps some of these areas. But it is a challenge, and it's a challenge for us when we're looking at things like the Essentials for Childhood and Adverse Childhood Experiences and things like that, where where some of the policy solutions are, supporting economic security and earned income tax credits and things like that. And NCSL tracks that. We track state EITCs, but we track state minimum wage. But I can't tell you that a legislature is, enacting an EITC because they want to reduce child abuse and neglect. That's where we're still having a hard time, I think, making those connections. Or it's not that we're having a hard time, we just don't know without talking to the folks in the room. And so for our Adverse Childhood Experiences legislation tracking, we're actually searching for that search term because for us, it's really interesting to see where legislatures are saying adverse childhood experiences, where they're actually, and same with some of our health disparities tracking, where they're saying social determinants of health, where this kind of public health lexicon is entering the legislature, to us is really interesting. And to have them draw those connections, because they, in some cases like ACEs and opioids, they are drawing those connections in legislation. But some of those larger social determinants of health around, housing policies or economic policies, that connection to public health is trickier. There are folks here at NCSL, like I said, that track some of those different areas. Folks in we have an education program, they're tracking a lot on school discipline and school safety and things like that. Like I said, folks tracking EITC and minimum wage. So sometimes we have something in the universe at NCSL, but it's those connections are the challenge.
Kate,
I'm still not sure I'm answering your question at all.
I'm curious, Kate, would you only track something like an earned income tax credit as part of child maltreatment and ACEs if it's mentioned in the lexicon of the legislators, or is there any reason not to track it anyway as something that could impact child maltreatment?
So for us in health, I'm only tracking it when they're making that connection. Because other folks here are tracking it more broadly, okay. I'm really interested in, are they doing it related to health? Yeah. And then I have access to their track, so in our ACEs policy brief, we have a map of state EITCs that my colleagues have made.
I've already tracked,
to make that connection. Because part of our role, right, is to educate state lawmakers about that connection. So that's what we do in some of our policy briefs and other publications like that. Okay. But in terms of our tracking, we do keep it a little more siloed. Some of that is just because if I started tracking the social determinants of health, I would be tracking pretty much all 150,000 bills each year. Yeah. So it would just become really unwieldy. I've had a lot of conversations about that. Like, I'd love to do that, but it's a huge challenge. Yeah. So certainly if there are other resources and things that are of interest, I'm happy to share what we have, or, refer you to just search around our website. We track Medicaid policies, and that affects health, right? So, there are a lot of different things out there that we're working on.
I think it's a good reminder, as we think about the impact of social determinants of health and policies that impact those social determinants, that it's not that NCSL doesn't just have health tracking or injury and violence prevention tracking, but also tracks on other state policies related to housing or education or income, stuff like that. So I think that's just a good reminder.
Yeah, we have that's great, because we have a lot of databases all across the building here, and I'd be happy to help point you towards some of those too. I know education maintains one or two. We have a child welfare database where actually some of the child fatality piece also gets tracked in their work, and that we do quite a bit of work on early childhood education in our human services and health program. It's often a collaboration, but I know that's a topic that relates a lot to child abuse and neglect and adverse childhood experiences. So we do a lot of work in that realm. And but yeah, we're getting better at making the connections, and state policymakers are too. They really are. They don't always, we're careful with language, like some of the public health jargon that you and I are used to is not always familiar to all of our legislators, or sometimes might be associated more with one side or the other. But I think that the fact that underlying factors affect people's health and well-being and their economic success and their ability to be productive citizens certainly resonates with our members.
Okay. I'm curious if you track on on just like any mention of like something that may or may not impact health, or is it, do you do any weeding out of like what is aka best practice policy versus not? Because like as we get questions that come in, we definitely want to be recommending and educating our legislators on best practice, and I'm just wondering what kind of resource NCSL provides around that.
So when we track legislation, we'll track whatever relates to the topic. So we're tracking state activity kind of without comment or value.
Okay.
Certainly, I think our policy briefs or our webinars or things like that allow us to, and really in the work that we do individually with state legislators, allows us to make those connections between here's the evidence base and here's where the policy space is. And I think that's something, as I mentioned, I think it's something they're more and more interested in, is what, they don't want to know all the research necessarily. So one of our wonderful North Dakota legislators said once, she said, I don't want to know how the clock is made, I want to know what time it is. So they don't always want to know the whole literature review and all of that, but they do want to know kind of where the evidence, what's shown to be successful. And if you have a return on investment, even better. And then we're able to make those connections to, early or state income tax credits is one of the policy solutions that, shown to have some promise. X number of states have done that. Here's how they've done it. So we do that more in our pubs, in our publications than in our tracking.
Okay. I think that this is a good, kind of a good segue into some of the questions that came through on our chat box. So Ali asked, do you know of any states considering application to the, is it the R01, not return on investment, right, Ali? The R01, which is a research grant to evaluate, to evaluate the impact of some social determinants of health-related policy changes on opioid outcomes. So Ali, feel free to chime in if you want to provide more context.
Yeah, there's an R01 that is out on policy evaluation right now, and it seems to allow for some unique evaluations, and not just directly related bills to the substance abuse outcome measures, but even some, I think their example was like housing on opioid or other substance abuse outcomes, and I just wasn't sure if you're aware. It's something that I know a lot of people have been talking about at the state agencies, but we're not best to do all of that or work ourselves. And so I'm curious if you know of anyone doing that.
I haven't heard of that from our legislators. I would certainly be interested in the outcomes of that.
Yeah, I think we all would
to share, but I don't know of any folks applying for it. Maybe some other folks on the call know if their states are pursuing it. I do know legislators are very interested in some of the federal dollars coming from states coming to states. Certainly the new CDC crisis, NOFO on opioids, the cures money all from SAMHSA, all that type of thing. They're real interested in knowing where it's going and what's being done with it.
Thanks. And then Carol Runyon asked, she's curious to know if NCSL tracks implementation and evaluation of any legislation passed. So I think you alluded to that a little bit, Kate, but and you mentioned around your pubs, but if you could elaborate on whether there's any formal mechanism that NCSL tracks on that.
So we're not well positioned to do any of that research ourselves, and that's where we lean on you all, and especially the researchers on the call, but also the states. You know, I think those are really they're valuable resources for us, and we do. You know, when we find them, we keep track of that type of thing. Certainly, as you know, Allie was just referencing, like on opioids, I think the question I get most is, what are states doing on opioids and what's working? I'm like, oh gosh, we don't know really definitively at this point in time. So I think, you know, those are, we do maintain those resources as a staff. I think it's probably less publicly accessible, like in terms of like a clearinghouse of the things that we have. From time to time, you know, on our web pages, you will see additional resources at the bottom and things like that. You know, we'll link to CDC or state evaluations or things like that. But it is something we tend to keep internally for sure and share with legislators when they ask, or again in publications or in meetings or things like that when they're relevant. But
okay, thanks.
Yeah, it's hard to keep track of, so send it my way.
yeah, that's helpful to hear. And then Des Runyon asked, could NCSL share information about the impact of paid parental leave on reductions in child abuse?
So again, we wouldn't be the person to speak to the impact. We're going to lean on other researchers and, you know, CDC and their elevation of that, you know, or other folks like that who make those connections versus, you know, us being able to speak to that impact.
Thank you. And then one other question in the chat box, and then I'll open it up to others on the phone or on the call if they have other questions. But Carol asked if someone wanted to read transcripts of debates about specific legislation, is that available through you?
So I don't think so at this time. We are getting, it should be available though. I mean, if a state has transcribed it, it should be available through their state legislative website. You know, I'm hesitating because through our LexisNexis service, we are able to see get connected more readily with bill hearings through video, like in California, I think is where they're starting that, but I'm not sure that's something that's publicly accessible at this time. So a lot of those types of things are really going to be housed on the state legislature's website, and they should be available. You know, most state legislatures are really good about putting a lot of information out, especially if you're looking at a specific bill. It'll say, you know, when it's going to be in the next committee. You should be able to find that out, hopefully, and tune in often through audio or, you know, here in Colorado, I've listened to it in my kitchen before, so to be able to hear those types of things. But I don't think it's to my knowledge, it's not something that NCSL would have on every bill right now.
Okay, thanks. Are there other questions from folks on the Zoom webinar? I actually have another one, Kate. I'm just curious. So, based on what you said about state legislators being generalists, and then also what you mentioned around them not always making the connection of certain bills to outcomes of interest that we're interested in injury and violence prevention. I'm just curious what suggestions you have for folks like us, either practitioners, mostly at state health departments, or researchers on how best to educate our legislators, especially if a lot of us can't formally advocate or lobby for bills because of our government roles.
Right. I mean, I think the education piece is really big. So, you know, legislatures are hearing a lot of bills. If you read the newspaper or, you know, watch any coverage, you see that toward the end of the legislative session, there's like, you know, tons of huge bills, like here in Colorado, you know, transportation and retirement benefits and all sorts of things that are being debated in the final hours. But even the pace of the legislative session is just frenetic in general. So education is really important. And I think, you know, making those connections is helpful. So if there is something, if there is a bill that relates to an outcome of interest for you, and it's, you know, so it's paid family leave and folks are thinking about it, you know, they're not relating it to health. I think that that's something that's important for legislators to know. And for them, I think it's probably really, you know, it's even more bang for the buck, right? Not only do we support folks' economic opportunity, but we're also supporting their health. And that's going to drive down, hopefully, costs for the state in the long term in terms of, you know, chronic disease or ER visits or what have you. So I think making those connections is important, and thinking about, I will caution that I think in public health, we do need to be careful about, you know, language and kind of the assumptions that we sometimes have that aren't necessarily shared across the spectrum. Just being able to, you know, make that, not always say the social determinants of health or other things that are kind of our jargon that we're really familiar with, but you know, being able to kind of talk to that broader audience about, you know, why it's important that families are supported and how it benefits them and how it benefits the state. So, you know, without advocating, I understand, I don't advocate either. So it's definitely an education piece. And always being concise is helpful too, because it is so busy for them. But even I think just being able to elevate that among all the noise that they hear. And outside of legislative session is a really important time too, for education and for thinking about bills. You know, right now, a lot of legislatures are thinking about what they want to do next year.
Right.
Their priorities will be. So I think now is an important, often the summer, the interim, and when committees are meeting and interim committees and things like that are really valuable education opportunities. So not just to pay attention to the legislative session. But I know there's someone from CDPHE who is talking about a legislative report. So there might be others on the call who have better sense of how they educate their lawmakers, you know, within the confines of kind of being careful not to advocate.
Yeah. I don't know, Kate, if you want to talk a little bit about that report, and actually this is a good segue into our more discussion portion, which we have a few minutes left for. But I did want to ask folks. I might stop sharing your screen.
Oh yeah, goodness, please.
Hold mine again. But one thing that I did want to ask folks is how they've used or how they could use NCSL in the future as a resource. And so something to consider in that light is that I know that for us in Colorado, we've used NCSL in the past to look up other states' legislation around various child fatality prevention issues. And Kate, I don't know if you would be willing to elaborate. Kate Jankowski.
No, didn't do that word.
Yeah, so I think a lot of what we've talked about already is really relevant for our child fatality legislative report. And so it includes data, as you said, and then really making that connection between, for example, paid leave and child fatality prevention or home visiting or better caregiver behavioral health. And so I think the way that we, as Colleen said, that we've used it to say, here's what's happening in other states and here's how Colorado could model that policy. So I think it's a really helpful tool. I would say that in our system, we're still learning how to best engage our legislators around these topics. And really, I think some of it is just making that really explicit connection to say this is a child fatality prevention strategy, even though child fatality isn't in the name at all.
Yeah, thanks. Do others have, ideas on ways they might utilize the resources that Kate from NCSL shared in the future, or if you've used their resources in the past.
Hey, this is Dwayne. I'll jump in and just share that I know our policy folks in our government affairs section use the NCSL resources as part of the larger body of work, but also when you touched on how to best engage policymakers, Children's, and I know a lot of other hospitals do as well, have, ours is called Child Health Champions, and it's just regular updates during the session. And I think recently they pushed out a synopsis of the bills that were relevant to child health or coverage. And there's, you know, as folks in Colorado know, frequently a lot of injury-related bills in that, some good, some bad.
Thanks, Dwayne. I think someone else was speaking up as well. I'm not sure if that was.
Yeah, this is Peg. I was just going to chime in that I don't have any specific examples at the moment, but this has just been a really good reminder to me that NCLS is a great resource for us.
Yeah, thanks. Same here. I was thinking the same thing, that they have a ton of resources, and I was jotting down. I think especially in just hearing about even the Policy Fellow activity or venture, whatever you're calling it, Kate, that you did this summer around opioid use, it's definitely something that I would want to, you know, look more into on who participated in that, especially because of that link to ACEs that has come up in that conversation around opioid overdose prevention as well. So final question, we have about 5 minutes left, but I'm curious, we've had a couple learning opportunities with the policy topic or focus area in mind, and now that for a lot of us we're in our off legislative season, I just am curious how our regional network can support our policy efforts for the upcoming year, how we can support each other, I guess, and if you have any ideas or for future learning opportunities or other ways that we can provide assistance to each other, I'd be curious to hear them.
If the states that were surrounding Nebraska would get helmet laws, it would help us in our efforts to defend our law every single year.
Oh.
I'm kind of kidding, but yeah, we're always.
Yeah, that makes sense. Yeah, I know that.
You know, if we could say, oh, Iowa has one or Colorado has one, it would sure help us. But oh well.
Yeah, I wonder if there's any work we can do kind of as a united front as a region that, you know, that we support this best practice policy related to our work. Something that might be worth exploring more.
I have a quick question for the other states. This is Dwayne in Colorado. Every January, the Denver Post, who's the largest daily newspaper in the state, publishes a preview of the upcoming legislative session and the bills that are the hot topics, the emerging topics, and so on and so forth, as well as a synopsis of the composition of the General Assemblies. I'm curious to know if the other flagship daily newspapers in other states do something similar.
I don't know if Peg from Nebraska or Sarah from Missouri or Corey or Lisa or Ann from Iowa can chime in on that. Or Jeannie, actually.
I'm not, this is Peg. They write about the legislature a lot. I think it tends to be more what's getting a lot of attention. You know, they'll write about that, not necessarily a preview of the session specifically. Like last year, they wrote a lot about, well, we had, there were just some interesting things that went on at the beginning of the session, and they wrote quite a bit about that just in terms of when they elected committee chairs and all those kinds of things. So I guess it just depends.
Yeah.
I do want to jump in and point out that in NCSL's kind of our legislative, or kind of our support of legislatures and some of the work we do around the institution in general. We do track composition of legislatures and things like that. So if that's something that's of interest to you, I know we're looking at potentially quite a bit of turnover in the fall. So if that's of interest to you, there are NCSL resources out there as well, kind of on the makeup of the partisan makeup, the representation of women, that sort of thing.
Great.
This is Lisa in Iowa. Sorry, I was going to chime in on the last question, but our flagship newspaper, the Des Moines Register, typically does a forecasting type of thing for the legislative season in January. Now, many of them are issues that are held over from last year, maybe that didn't get passed, or some emerging issues like Peg was talking about, but we too have that kind of in our major newspaper at the beginning of the year.
It makes me think that it would be interesting to see across the states in our region if there's any common topics or types of bills that are possibly upcoming in our legislative sessions, maybe beyond topic areas, but even getting more specific on like there's a bill that's going to be introduced to address X, Y, and Z, and maybe there's an opportunity for us to do some peer learning and sharing around resources or data that we can educate state legislators about specific bills, so that we can be coordinated across our region as well.
It's a great idea.
Well, we are just about at time, so I'm gonna just remind folks that our next learning opportunity is in a month on Wednesday, July 25th, 1 to 2 Mountain Standard Time, 2 to 3 Central Time, and the topic is TBD. So if there's any hot topic or burning issue that you want to discuss as a group, I'm totally open to hearing those and can help facilitate or coordinate possible presenters or anyone that would be willing to help facilitate. I'm open to that as well. A big thank you to Kate Blackman from NCSL. It was really great to hear about the resources that NCSL has to offer, and I really appreciate everybody for participating today and engaging in the conversation and discussion and asking good questions. And I will be following up with some job postings and the recording of the webinar from today, or the learning opportunity from today, so that for those who couldn't make it, have that as well. And with that, thank you very much.
Thank you all for having me. I enjoyed it.
Thanks, Kate.
Thank you.